Hello, everyone, and many thanks for inviting me to this webinar. Thank you, Mr. Laufey, for the invitation and New Vision. So today I will be presenting two papers, two of our techniques in East Kent hospitals. One is a case report recently been published, and the second is our preferred technique nowadays for pterygium surgery. Both using the Omnigen amniotic membrane. As you know, my name is Nick. I'm based in East Kent. I'm a corneal consultant. I have no financial disclosures whatsoever. And let's start with the first case. Now, this is a 73-year-old man. He has ocular graft versus host disease. He has chronic myeloblastic leukemia, and he's on treatment for that. He presented to our cornea department with pain and photophobia in his left eye. He was already using preservative-free artificial tears, topical cyclosporine, and dexamethasone preservative-free eye drops. And looking at the slit lamp here, you can see a very marked paracentral corneal stromal thinning with epithelial defect. There is no active infection, no infiltrates to be seen, or anterior chamber inflammation. There was normal fundus. However, if you look at the anterior sigmoidosity, you can see how much the thinning is. We measured, I think, 148 microns at that point. So this is a cornea with a pending perforation. So instead of taking the patient to the operating theatre and performing surgery, we decided to perform a multi-layer amniotic membrane implant in the clinic. This is the technique. If you look at the anterior sigmoidosity here, we use two Omnigen grafts, one to fill in the gap and integrate to the corneal stroma, and a second Omnigen graft to cover the first graft. These were both 12mm round Omnigen grafts. At the end of the procedure, we placed a large bandage contact lens, 20mm in diameter, to cover both grafts. The patient was commenced on cyclosporine, dexamethasone chloroquine eye drops, and was seen a week after surgery, 4 weeks after surgery, 2 and 3 months after the procedure. Looking at the results, there was marked clinical and structural improvement. This is again 1 week post-op, where you can see the multi-layer implant, and down here 4 weeks post-op, where we can see a good integration of the amniotic membrane, but also increase in thickness of the epithelium, both on the stroma, about 230. Remember, the original thinning was about 140, now about 230, so again, almost 100 microns with this technique. The patient was happy, we were happy too. What are the advantages of this technique? First of all, it's a sutureless technique, and we didn't use any glue, and it's a quick procedure. It was done in the outpatient clinic, and we found that the patient responded very well. There was good integration of the Omnigen, and in this particular case, a pending perforation was avoided. So that's that from first paper. If you have